Picture this. You're sitting calmly, and your own hand draws back and slaps you across the face, hard enough to bruise. You didn't decide to do that. You're telling it right now to stop. It isn't listening. Not because it's malfunctioning, but because the part of your brain giving that order and the part swinging the hand are no longer on speaking terms. This actually happened, repeatedly, to a woman in New Jersey. Doctors have a name for what's happening inside her skull, and it sounds like science fiction. It isn't. Alien hand syndrome is real, it's rare, and it's been formally recognized in the medical literature since 1908. It shows up after several kinds of brain injury, stroke, tumor, degenerative disease, but the case that put it on the map came from a deliberate surgery. For people with epilepsy so severe that nothing else works, surgeons sometimes cut the corpus callosum, the thick band of nerve fibers that lets the brain's two hemispheres talk to each other. It's called a corpus callosotomy, and it works. It stops a seizure on one side of the brain from spreading to the other. What it also does, in some patients, is leave one hand answering to a part of the brain the rest of the person can no longer consult. Here's the part that should bother you a little. The hand doesn't stop working. It keeps working perfectly, just for somebody else's agenda. Most people who've heard the term picture a tremor, some uncontrolled shaking, the kind you'd associate with Parkinson's. That's not what this is. The hand doesn't shake, it acts. It reaches for a glass, picks up a pen, unbuttons a shirt. Complete, coordinated, goal-directed movement, with no sense on the patient's part of having decided to do any of it. The neurologist Kurt Goldstein described the first documented case in 1908. A 57-year-old woman whose left hand began grasping at things on its own, and by the account of the case, at one point tried to choke her. She died years later, and an autopsy found strokes in her right hemisphere and her corpus callosum, damage in exactly the regions you'd now expect. For decades after that, the phenomenon didn't even have an agreed name. In 1972, the researchers Sandra Bryan and Czeslaw Jedinak coined the term the sign of the foreign hand for patients with corpus callosum tumors who couldn't recognize their own arm without looking at it. The neuroscientist Joseph Bogan later borrowed the idea and reshaped it into what we call it today, adding a phrase for its most dramatic form: intermanual conflict, when one hand actively works against the other. Here's the mechanism, in plain terms. Your two hemispheres aren't identical twins, they specialize. In most people, language production sits mainly in the left hemisphere. Cut the corpus callosum, and the right hemisphere doesn't go silent. It can still perceive, want, and act through the hand it controls. It just loses its only line to the half of your brain that does the talking. So the left hand can reach for something the right hemisphere wants, while the half of you capable of explaining yourself in words finds out about it after the fact, the same way you'd find out about a decision your roommate made without asking you. Most of us never notice this division because the bridge stays intact and the two halves negotiate constantly, silently, thousands of times a day. Alone hand syndrome isn't creating a second will inside your head. It's exposing one that may have been there all along. Let's go back to that hand, the one that slapped its owner hard enough to bruise. It belongs to a woman named Karen Byrne, and hers is one of the most thoroughly documented cases on record, covered by the BBC, CBS News, and NPR's Invisibilia. At 27, after years of near-constant seizures, she underwent a corpus callosotomy. The epilepsy stopped. What came back instead was a left hand that acted on its own, stubbing out cigarettes the moment she lit them, dumping her coffee, hanging up the phone mid-call, reaching into her handbag and taking things without her noticing. It also, repeatedly, slapped her hard enough to bruise. This is one documented case, not a universal pattern. Alien hand syndrome looks different depending on which part of the brain is involved. Byrne herself developed a theory over the years, that the hand was punishing her for smoking or cursing, enforcing rules absorbed from her upbringing. That's not a medical finding, it's her own interpretation, built from trying to make sense of something senseless. What's medically happening is simpler, and somehow stranger. A hemisphere with no way to explain itself, doing what it wants anyway. Byrne's case is one specific kind: colossal alien hand syndrome, caused directly by cutting the bridge between hemispheres. A 2025 systematic review of the published case literature sorted AHS into 3 recognized types. There's frontal alien hand, from damage further forward in the supplementary motor area and parts of the prefrontal cortex, which tends to produce grasping the patient can't release. And there's posterior, or sensory alien hand, following damage to the parietal lobe, often after a stroke, which adds a stranger twist. The patient may not just lose control of the hand, but fail to recognize it as theirs at all. That same review covered 72 patients in the literature, ranging in age from 9 to 89, split almost evenly between men and women, with the corpus callosum, the supplementary motor area, and the posterior parietal cortex as the regions most often involved. Causes ranged from stroke to brain tumors to degenerative diseases like corticobasal degeneration, and rarely Creutzfeldt-Jakob disease. No cure exists. Treatment is closer to damage control. Benzodiazepines like clonazepam, botulinum toxin injected into the affected limb, and, somewhat low-tech, simply teaching the patient to keep watching the hand, since vision helps the rest of the brain keep it in check. In one published case, clonazepam cut a patient's arm levitation episodes by 73% within days. When a bad reaction forced doctors to stop it, botulinum toxin did better still, cutting the same movements by 84%. The condition also picked up a Hollywood nickname, Dr. Strangelove syndrome, after the Kubrick film where Peter Sellers' character wars with his own saluting arm. Neurologists like the comparison enough that it stuck, though some film historians argue Kubrick's mechanical arm actually echoes a much older film, Fritz Lang's 1927 Metropolis, and its mad scientist with a prosthetic hand. Even the nickname, it turns out, has its own case of mistaken identity, which leaves the real question, the one that has nothing to do with neurosurgery. If a hand can reach for a cup, grip it, lift it, all without the rest of you ever feeling like you decided to, then what exactly is the feeling of deciding? Neuroscientists still don't agree on how the sense of willing an action gets attached to the action itself in an ordinary, undamaged brain. Alien hand syndrome doesn't answer that question. It just pulls the curtain back for a moment, in extreme, involuntary cases. The rest of us go through life assuming there's one of us in here, quietly running the show. Most of the time, that assumption holds. But somewhere in your skull, right now, two hemispheres are negotiating decisions you'll never consciously notice, and the only reason you don't feel like a committee is that, so far, the line between them has stayed open.